So, as I was explaining in the previous video, if say we have a certain number of receptors in our body, what is going to happen to us is that if these orange tablets are the drug molecules of a medication A that has been given to us for reducing our pain, some of those pain medications which I described in the previous video are called opioid medications, and those opioid medications usually have these opioid receptors where they have to go and bind to the receptors for their action to occur in the body to reduce the pain. Now, if we have a certain number of, our body has a very limited number of receptors in the body, because of which when we start taking a medication, say you were given a 30 milligram dose of a medication and you're taking it initially for a few days, what happens is as we take the medication more and more continuously in our life for a long duration, every day a certain amount of medication is absorbed in our blood and taken to these different organs via our blood and circulatory system, and also a certain amount of drug, like how our blood takes oxygen to our different cells and then takes the carbon dioxide from our cells back to the lungs to expirate it out. Same way the blood's other function is when it is delivering these drugs, some of these drugs are also getting washed away from the other blood and taken away from these cells. That's why people keep taking medications daily and they have to take 1 tablet a day, 2 tablet a day, depending on how long the drug is acting where it is supposed to act for us. But while the drug is absorbed, and if it is not a very targeted drug, it will be spread all through our body. So initially, if you're taking 1 pill a day or 2 pills a day, there are still many receptors in different parts of the body. Some of the drug will go and bind to your pain receptor in your neck. Some of the drug will go and bind to the same pain receptors that are not just present in your neck area if you have neck pain, but it is also the same receptors are also present in your back area, in your arms, in your legs. So as you're increasing the dose of the drug, some drug goes to your neck area, but the other drugs are also other molecules that are still getting absorbed by you will go and attach to the receptors in different parts of your body. So what is developing, how drug resistance is developing is, initially when you increase the dose, why you need to keep increasing the dose is because, and you may still see some benefit from the drug with the increased dose, is because part of the drug is getting absorbed in the body, part of the drug is getting eliminated from the body. So there is a continuous circling loop of the drug entering and exiting your body. But after a while, when enough drug molecules have accumulated in your body, the exit of the drug reduces from your body. As a result, what is happening is, not only are the drugs sitting in these receptors, they are also accumulating now in your blood cells. Now, after accumulating in the blood cells, and if say the pain is not relieved by medication A, now the doctor has given you 2 medications. They're both opioids, so they're both acting on the same receptor. So you're taking, say, hydrocodone and tramadol. So now hydrocodone is sitting on some of these opioid receptors, and tramadol is also sitting on the other opioid receptors. They're both, because very similar drugs, they will always act on same kind of receptors. So even though you've been given 2 drugs, number of receptors hasn't changed. And also, if both drugs you've been taking for a long time, say 5 years, 2 years, 10 years, and a large amount of the drug you're taking, slowly the drug is building up in your body, and not only is it going to attach to the opioid receptors in the pain area, it can also start attaching to different receptors. It can start just accumulating in the body as a toxin and accumulate in your different organs. That's why if you see if someone dies from drug overdose, they will have respiratory failure, cardiac failure, because you're not taking the drug for your respiration problem, you're not taking the drug for your cardiac problem. but these receptors are present in different parts of the body. The blood is circulating in different parts of the body. So as the blood is circulating and as this drug is accumulating, and why is it going more to your respiratory organs or causing respiratory and cardiac failure, or sometimes it can cause, some of these medications can cause liver and kidney failure, because these 5 organs are involved in our circulatory system and elimination system's functions, because of which if the drug is now excess in your blood, your body wants to get it out of your system. So cardiac system is trying to eliminate the blood and trying to do its function, and more of it will first eliminate in your cardiac organs, because heart is the one who's pumping the blood. So everything from the whole body ends up in the heart eventually. That's why some people can get cardiac arrest. Same way some people can get respiratory arrest, because if enough of this drug has accumulated in your lungs also now, because the cardiac system is also overloaded, it can start binding to receptors in your lungs and respiratory system and cause harm there. Or if your liver's function is to eliminate anything that is toxic to your body, anything that is extra in your body that your body doesn't need, liver is also continuously trying to eliminate these drugs from your body. As a result, if you take a lot of medications for a long time, or 3-4 different medicines for a long time, but higher degree and higher dosages of it, your organ systems can start failing, your organ systems can start malfunctioning, and which again causes a feedback loop of your pain not getting resolved, because now multiple things are going wrong in your body, not just simple one thing that was causing your pain to occur in your body. So what is the solution to this problem? And there is another difference between if you're taking an antibiotic and if you're taking a pain medication. In pain medication, the number of places where the drug can sit in the body and function in the body is less. And it's limited. It's less meaning it's limited. There is only, in this diagram, there's 6 receptors. So the drug can't go, even if you keep increasing the dose, if 6 receptors are occupied, increasing the dose is not going to relieve your pain. What will relieve your pain? Then you have to think, what is the cause of the pain? Because people can get pain for many reasons. People can get pain from having some other toxin in their body which is initiating pain, causing some bone pain. People can get muscle pain. People can get nerve pain. People can have emotional pain from emotional trauma. And if you have all these 5-6 different kinds of pain occurring to you repeatedly from different reasons, each of them are responsible for your pain. But if you're only treating, say, muscle pain with a muscle relaxant and not addressing the other reasons for your pain, will it help you? Then also it will not help you. If you are treating your pain, meaning you just want to stop the experience of that pain, which is what the opioids do. Opioids are designed to just stop the experience of pain, block the pain from getting transmitted to our brain. But the thing is, the reason why your body is experiencing pain usually means there is some threat and toxin to your body. What is the threat? What is the toxin? If you address that, that is more beneficial in helping you with your problems. Because of which, sometimes, instead of taking pain drugs, if say your body just needs to relax and rest, sometimes if I just rest, if I just sleep, that will help me with some minor degree pain. Sometimes if my pain is caused by some toxic chemicals in my environment that is damaging my muscles, that is damaging my bones, as a result I'm getting the pain, stopping the exposure to the chemicals in the environment will stop my pain. So if you become more mindful, more aware what is going on, and there's another way, not just stopping the chemicals and toxins in your environment, say the chemicals have also accumulated in your body. Along with the drug, there are some chemicals that are impacting your pain. Those chemicals that might be there in your water, that might be there in your air, chemicals that might be there in your clothes, chemicals that might be there in your food, they are also getting absorbed by the blood, they are also getting circulating in the blood, they are also damaging your organs and bones and blood. So when some chemicals are there in your environment, it is also accumulated in your body. If you go to a physiotherapist, or if you go to a massage therapist, or if you take a Ayurvedic massage therapy, what do these people do? they will use some physical mechanism to eject the toxins out from your body, some medical mechanism to take the toxin out of your body using oils and other things, because oils can absorb these chemicals. Oils can then help in eliminating these chemicals from your body, either when you're doing a physical massage on your skin, or when the oil gets absorbed in your stomach and then via your elimination system of excreta, it will get eliminated from your body. So if the drug and the chemical is oil soluble, then a oil massage therapy will help you, right? So if you take just medicine and you're only wanting to address that I don't want this pain, you have only been in the first step, right? If you really don't want this pain, you have to stop the chemical or other things that are causing your body to feel the pain. If you stop those root causes, then you won't even have to take medicine, or you might have to take very less medicine compared to just simply increasing your dose, because by increasing the dose, you're increasing the toxins and toxic load or harmful load in the body, because the same medicine which has the capability to ease your pain also has the capability to cause side effects or adverse effects or overdose related effects if excess of the chemical is present in your body, because all of these are chemicals. Drugs are chemicals in the body, not natural chemicals, so some of them are unnatural to your body. That's why if they are there in vast amounts or excess amounts, they can start causing damages and further health issues. So, but what is the difference between when you take a drug and increase a dose when you have a bacterial or a microbial infection? Say I have a pimple and I have a microbial, the pimple has been caused by this bacteria which is growing on my skin. Now if I take drug A and that drug A is applied on my skin, this drug, being an antibiotic, will kill the bacteria. That's how it will help. If this drug also has, along with the antibiotic, if say they gave me 2 antibiotics, why will they give me 2 antibiotics? If for example this bacteria is not as effective when only 1 antibiotic is given, then the doctor might also give you 2 antibiotics. Sometimes not just 1 antibiotic is given, the same pimple cream will have antibiotic and an acid, because the acid will help in breaking down the pus like creations in our pimple. So there are different mechanisms again to resolve a pimple, and only increased dose or increased drug should be given. If I keep applying, like I have only 1 dot pimple and I apply the pimple to the whole body, it's useless, right? Because it's not there, the bacteria is not there in my whole body. So that same principle is there, that if you take excess drugs or if you take drugs that are not needed by your body currently, depending on your body's health status, you can end up having drug harm. So now let's go to the patients who were suffering because say someone had, while during their pregnancy, a ruptured uterus. Now there are multiple factors which will determine a doctor giving them a certain medication. Say you went to an elderly doctor who has experience of 30-40 years delivering babies. Because the doctor has 30-40 years of delivering babies, and because he was an older doctor, in his day and age, a patient's pregnancy problems were easily resolved by giving them some anti-inflammatory medication and a little bit of opioid medication. Or they might not even give opioid medication because opioids weren't massively prescribed initially in our healthcare systems. So as a result, they might only give you a very minor, smaller dose, and there is a secondary reason for a doctor doing this. Because if you are a pregnant nursing mother, you've given birth to a baby, if the doctor gives you high doses of a drug, if the doctor gives you multiple drugs to control your pain, what is going to happen to you is same principle again. All the drug that you are absorbing, while it will go to your uterus area where you have the pain occurring, some of the drug is also going to go to your breast. It will go to the breast via the blood cells, and from the breast it will go to the breast milk, and from the breast milk where it is going to land up in the body of the infant you are feeding. So if you are a nursing mother experiencing a lot of pain and taking a lot of drugs, there are two harms present to the baby. If the doctor gives you opioid medications, which are also very drowsiness causing medication, what will happen is you will feel so sleepy, you will not be able to nurture the baby, take care of the baby, you might feel like sleeping through the pain, which is okay if you have decided on a plan to bottle feed your baby, if your husband is supportive, if you have supportive systems in your home who can help feed the baby, you take a pain medication, you sleep, you will be fine. But if you're a single mother, or if you are a mother whose husband is always busy, doesn't help, or if you're a mother who is an abused wife, his husband is her husband is not helpful, or her boyfriend is not helpful, and the doctors sometimes, if they are very experienced doctors, they can perceive this from the nature of the husband, from the nature of the wife, from the body pain that she's experiencing while giving birth. He would have observed if a how the husband is, how sensitive he is to his wife's pain, how sensitive he is to his wife's needs, right? So because if you're an experienced doctor, you also develop not just skills about medicine, you are developing skills about human psychology and about patient history, right? Because patient history also sometimes determines how a doctor is going to prescribe you a medicine. That's why those women who have felt really that it is unfair that for high degree of pain they got very small amount of medications, whereas their husbands for a minor pain are getting all these massive drug prescriptions, they have a right to feel angry. But here two perspectives of two doctors are coming into play, and two different things are also coming into play. One of which related to motherhood is this: if your husband is not sensitive, if you don't have supportive health systems to help you rest and relax at home, you actually need that pain to keep awake. You actually need it, like it's a psychological thing that I have to stay awake, because otherwise your baby will be in danger. If you are not a good caretaker and nurturer for your baby, your husband is not a good caretaker and nurturer for you or your baby, the baby's health will be in danger. It will not get fed in the right way, it will not get cleaned in the right way. If you don't feed the baby, clean the baby in the right ways, that also adds to the baby's health problems. If you're taking extra drug, that will also impact the baby. And the same drug, the mother is like a 60 kg, say a mother is a 60 kg mother or 80 kg mother, and the baby is only 5 kgs. That baby is so many times smaller than the mother, so the same drug that for the mother is beneficial can end up being harmful for the baby. That's why also certain doctors will not prescribe you heavy medications unless the patient insists. And this is the other thing that women also don't know, patients also sometimes don't know. If your doctor has prescribed you a drug, that drug, if it is not controlling your pain, if you must have a drug to check your pain, if you do have a system where if you fall asleep the baby will be taken care of, if all these factors are present and you are a responsible mother and you want to address your pain, you have to think of some alternatives and better quality of life alternatives, both for you and the child. For the child, then, if you want heavy pain medications, you can ask a doctor, you can see the same obstetrician, or you can see a regular gynecologist who will be checking with you regularly after and following up with you, right, to see how you are. You should see a gynecologist also, you should see a child specialist also for taking care of the child's needs. But now that if you are taking extra drugs, more drugs, many drugs, now then you have to decide, if I'm taking more drugs, should I breastfeed the baby, should I not breastfeed the baby? Now the level of awareness of the doctors you see will determine whether you will get quality care. So that's why those women who are talking about medical gaslighting are also right. There is a certain amount of medical gaslighting that happens, that if I go to a doctor, if the doctor is unable to understand the depth of my problem, the doctor will resolve only part of the problem. If I don't see a doctor, say I see a nurse practitioner because I'm not that rich or my insurance is not allowing me to see a doctor, I go and see a nurse practitioner. then also the same thing. It doesn't matter what degree they have, whether they have a doctoral degree, a nurse practitioner degree, internal medicine doctor degree, gynecologist degree, obstetrician degree. Their degree plays a role, but their depth of understanding of a patient's situation and the depth of problem solving for a patient also plays a role in whether you will get the right treatment or the wrong treatment. And also, as a patient, you have to also become more aware. In US, at least, in India this is not there, but in US a patient is given a package insert, a patient is given drug information, all the information related to whether, or many of the information, because all information is a little difficult. There are so many things continuously happening in the medical world that keeps changing, that 90% of the information might be there in the package insert, 80% of the information might be there in the information that the pharmacist has given you, but still there might be many information that is unique to you depending on you as a patient as well. That's why being mindful is necessary. But can you be mindful if you're constantly drugged or on a high dose of any medication that makes you feel sleepy? You can't. And that's why many times doctors don't give very high such kind of drugs that will make you extremely sleepy. And there are also some drugs if you're feeling anxious, if you're feeling some other health symptoms as a result of your pregnancy, like postpartum depression. Sometimes with postpartum depression also, again the same problem. You have to see the right doctor, you have to see the doctor who matches your depth of understanding of your problem. You have to also develop a depth of understanding of your own problems, because if you don't have an understanding of what are the factors impacting your anxiety, say you're anxious, you're an anxious wife after giving birth, or you're a depressed wife after giving birth, why will you have depression and anxiety? One reason will be because you don't have a support system structure. Another reason could be what foods are you taking. If you're taking foods because you're breastfeeding a baby, if you don't take the right foods, majority of the nutrition first biologically will go to the baby, because that is how the body is designed, women's body is designed. We are the nurturing caregivers. Because we are the nurturing caregivers, if you breastfeed a baby, first nutrition will go to the baby, then the rest remaining nutrition that you had from your food will go to you. So the main nutrition is going to the baby, the main immune supportive factors are going to the baby. That's why it has been researched and said that initial few months, if the baby is being breastfed by a mother, some good immune suppressing like immune fighting things are also going into the breast milk and getting delivered to the baby. So the healthier a mother can stay, the more balanced nutrition a mother takes, the more excess nutrition also a mother has to start taking. Because many women do this, that before pregnancy, if they say they were having 100 calories of vegetables, 100 calories, and I'm giving random numbers, I'm not a nutritionist, but let's say for having a balanced meal, there were 100 calories of vegetables, 100 calories of protein, certain calories of carbohydrates, certain calories of fat that you were consuming. Now if you are a very health oriented mother or wanting to maintain your figure, some of us, we also do, and I have done this to myself, so which impacted my health. I will go on a diet recommended by my dietitian or my gym trainer or something that I have seen online, and I might be following that. But while it is okay to follow it before you became a mother, after becoming a mother or during pregnancy, if you don't eat the right foods, if you haven't increased your calorie intake, are you going to harm your child during pregnancy or after pregnancy? Right? Because if I keep eating only 100 calories of certain whatever was my calorie thing, like say in a day I was eating 1800 calories total of different food groups, and I was eating a balanced diet, while for a woman of a certain weight, that 1800 calories was the right diet before pregnancy. During pregnancy, as I'm developing and nurturing a baby and a baby is growing in my body, if I continue eating 1800 calories, it is wrong, because the baby also needs calories. So that's why in pregnancy many women start increasing eating certain food groups, because their body will automatically nutritionally tell you where they are challenged and try to guide you in eating more of the calories or more of the vegetables, fruits, proteins that your body needs for sustaining the baby. But same is also true after pregnancy, that after you have given birth and when you are feeding the infant or a toddler, because some women feed the child for 1-2 years, right? So in those 1-2 years, while initially also whatever nutrition you took was okay for you to take when in the first few months of pregnancy, again as the baby is increasing in size, its milk supplies quality also has to increase. But it can start decreasing if, again, say as a pregnant person you have increased your meals from 1800 calories to now say you have increased it to 2200 calories. But while 2200 calories was sufficient for a baby when it was inside your body and sufficient for a baby after it has been given birth, again, if you're feeding the child for 1-2 years, now from 22 calories you have to go to 2500 calories. And you can't look at your weight. You can look at your weight by going on walks, doing moderate level exercises. But here again, there are women who will take medicine thinking I have a ruptured uterus, or take medicine because they had a painful birth. And as soon as they take a medicine for their pain, what will happen? My pain is not there, so your body will automatically give you a false illusion that you are healed. So if you get more medicine, what will also happen, more medicine than what your body requires, or even the just right amount of pain medicine to control and manage your pain, you might falsely start thinking that I am healed, and you will start running more than you should, or you will start doing more physical activities than you should. Whereas for a ruptured uterus, or even if it is not a ruptured uterus, after pregnancy, if you had cesarean or if you had a normal birth also, some biological changes have happened inside your internal organs. Some of the organs are still healing from the birth. Some of the organs are still processing what has shifted in the body because the baby is not inside the body anymore. Some of the organs are also now trying to process the breast milk to give the baby the right nutrition. So many multiple things are happening. So what does the woman need? The woman primarily needs rest, needs help with childcare, needs a supportive system at home life. If you don't have a supportive system, you will have this depression. And to eliminate the depression, say you take a medicine which lifts up your spirits, those same medications now have the side effect of causing anxiety too. Or if you take those medications along with coffee also, because now that you're depressed or now that you're tired, you want to drink coffee or tea to increase your energy levels. But again, if you do that, it is a false paradigm, because you're using non-aligned things that if you keep using it, what will happen? Say you're drinking tea or coffee to increase your energy. Again, the same tea and coffee will go into your baby. Or if you even drink Red Bull, say Red Bull or many caffeinated energy drinks are there, people can start doing that also falsely. If you start doing that, all that chemicals in your body will go to the baby also from breast milk. Then what will happen? You've now created a feedback loop of the baby also not being able to sleep. You are also high on the chemicals and wanting to have the energy, but the baby also has excess energy. So there are many women now, you're tired. Why? Because neither can you sleep nor is the baby sleeping. The baby is cranky, because if it is awake, it is cranky. But normally you should, that's why allow, when an infant is small, most babies will be sleeping for hours and hours. I am not a mother, but my friends have given birth. I've gone and caretaken their kids occasionally, very rarely. But I know this, and I'm a pharmacist also. So some of this I have studied also as a pharmacist. So that's why it's very important to understand yourself, understand your baby better. If you really want to increase your spirits, do some meditations or do some exercises, but exercises at the level of your body's health status. If you do the same level exercise that you were doing before pregnancy, you will harm your body. And you will not understand the harm if along with doing the same exercises, you're not observing your body's changed dynamics, or you're not observing your kid, or you are not observing how it is mentally and physically causing some harm. And especially you won't understand if you have suppressed your normal natural instincts by taking a lot of medications. because that can happen. Your natural instincts get suppressed by taking medications, because your body naturally otherwise will align to certain things going wrong, indicate to you eat this food more, rest more, take rest. If you're crying, it is necessary that your body gives you the signal for crying. Now if I suppress my crying by taking the drug, what will happen is I will not understand when I need rest, because now my mood is high. But it's a false light. If I have a high mood but internally my whole body is so tired that if I cry, I know I need rest, I will go into the corner of the room, turn off the lights, sleep for a while. When the baby is asleep, I'll take these measures. But as soon as I take medicine, or if I cry, if I have a good husband, if I have empathetic in-laws, if I have empathetic friends who can help me, my crying might cause me to call up a friend like, please come and help me, I need help. Or even while talking to them, I will start crying. While I was talking about a simple thing, I'll start crying. And if you're unempathetic, you will give medicine and say, stop this crying. But if you're empathetic, you will understand. The person who is talking to you will understand, this person is a depressed mother, she needs help, let's go and get some help for her. One of my friend's husbands, his wife was very depressed. She was not able to cook, even though her depression was not manifesting as a depression symptom, but she was getting problems cooking. She could also have health problems while cooking, because now her body is a little bit you are not sometimes, in Indian cultures, many women get offended when their in-laws or someone say that you need rest because you're sick or whatever, and women are like, no, I'm not sick, pregnancy is normal, blah blah blah. But it is actually true, you are sick in some ways. Sick meaning you are in the recovery phase of pregnancy. You are not sick as in physically sick. That also can happen if you have ruptured uterus, if your spinal cord got damaged, or if some pelvic bones got damaged, whatever else happened to you biochemically or functionally or structurally, all that impacts your level of health. So your health is impacted. It is true that you're not sick, but your health is impacted. And to help with that, you need more of rest, more of love, more of care. And if you don't have that in your life, say you're a rich person, you can at least get that care by hiring a temporary nanny. You can get that care by, which is what my friend's husband did. They were not super rich, they were average middle class Indians living in a middle class salary of America at that time. And what he did was, he went and got some lady who would deliver food to their, she wouldn't deliver the food, she had a tiffin service. So the husband had to daily go and pick up the food from this lady, and the lady gave a balanced diet, all the food that the woman needs, her husband needs. Their daily meals were there in this diet that was being given by this someone else who was cooking. So you can hire a cook, or you can go and get a tiffin service, or you can start eating a little bit more in the restaurants. Only problem is with restaurant food, if that restaurant is not hygienic, you can't keep eating fast food then. Why fast food is unhealthy is because if it is being cooked in a fast culture, the people managing those places may not have the cleanliness and hygiene that is required as a safety for a nursing mother or a pregnant mother. That's why even if you crave a fast food, say you are craving a burger, say you're craving some fries, instead of getting it from a fast food, if that fast food restaurant is top quality, maintained well, managed well, and you have seen this already by living in that area, you can go and eat it. But if that area and facility doesn't have good management, even if you're craving a burger from that place, don't eat it. I would suggest either go and eat it get a good cook to make it for you, get some family to cook it for you, or go to a high-end restaurant to eat these meals. And these are all essential part of a woman's life, that a woman has to also self-care, but a woman has to also seek help if she's not getting the help from say her husband is too busy with work, or her family is too busy with their activities. Then you have to find time for your either self-rest, self-care, self-nurture, or gain help from other mothers. Because if you're a single mother, you don't have too much of a time to invest in self-care, then form mommy groups and work with those other mothers, so that together you can do child caretaking activities jointly as a group. That also you can start doing, right? But can you do any of these, can you think about any of these unless you are in pain? When you are in pain only you want to resolve the pain. But if the pain goes away, maybe it's emotional pain that no one is supporting you, maybe it's physical pain that your internal organs haven't healed, maybe it's nutritional pain that you are not eating the right food. But if you're with another mother, she will tell you, if I eat this food it has helped me, you can try that out. Or both of you can start cooking for each other, that I cook lunch, you cook dinner for me, you can do that, right? But again you have to find the right group. And that's why also when people are trying to also meet and make new friends, if they are not aligned with your soul path, like say I am a vegetarian and she is a non-vegetarian, unless a non-vegetarian cooks vegetarian food for me, it won't be a aligned mommy group with them, right? Or if I cook vegetarian food not taking into account the non-vegetarian person's high calorie needs, because most people who are non-vegetarian have a high calorie diet also in some ways, and their body has gotten used to this high calorie diet. I have this problem with my own cousin. Even though we are Indians, even though we were born in my cousin is my aunt's daughter, we both had the same grandmother and same grandfather. But despite that, and we also ate some similar foods while growing up, but I am more vegetarian oriented, she is more non-vegetarian oriented, and she needs high calorie meals to sustain her energy, but I don't need high calorie meals. In fact, too much high calories cause me to feel drowsy and lazy, and I do not like high calorie meals. Very rarely do I consume high calorie meals. If I have been calorie deficient, then I will consume high calorie meals. Otherwise, I don't do that. So all these mindfulness, if you do, the mindfulness will come from where? Self-awareness will come from where? If you do listen to some relaxing music, it will relax you. Even if you're depressed, the relaxing music can cheer you up. Even if you're depressed, if it is the right music you're listening to, the same music when you're depressed has the capacity to raise your spirits, and also has the capacity to calm you down if you're getting anxious and overwhelmed, that how will I navigate motherhood. That's why also, that's why when women are saying they didn't get the right meds, understand that the trajectory of what the doctor might have seen in his practice, he or she might have taken the decision that giving the patient little less medication is safer for the patient and the baby. And if the patient does ask for more medicines, the doctor will provide that to the patient. But then you have to judge whether that excess medicine will impact my functional abilities as a mother, will impact my biological abilities as a nursing mother, or what should I do about that? Because every choice a mother makes does have consequence. That's why it's very natural for a mother to feel this anxiety, to feel the depression, and also necessary as a result of those anxiety and depression to get help from anyone that they can get help. I hope this was meaningful to you. I will address the gaslighting related to cancer patients in my next video. Thank you.